Hi everyone, my name is Elizabeth Word, and today I'll be presenting on the Arkansas Children's Nutrition Center, or the ACNC for short. I chose this program for a few reasons, but the biggest one is my love for kids and my belief that the best time to build a healthy life is at the very beginning. Early nutrition is so powerful, it shapes everything from physical development to metabolism to brain growth and even long-term disease risk. What a child experiences nutritionally in the first few months and years of life can literally influence their health decades later. For me personally, I want to be someone who reaches children early and helps support healthier futures. I think that giving kids a strong nutritional foundation is one of the most meaningful things we can do in the public health. When I learned about ACNC and saw how deeply they focus on maternal and child nutrition, I immediately felt connected to their mission. This is a program that does real, impactful work right here in Arkansas, and I'm really excited to share more about their purpose, their research, and the difference they're making for families in our state. So I selected ACNC because it perfectly matches what I care about in health and nutrition. Their focus is on moms, infants, and young kids, the population where nutrition has the most long-term influence. When we support pregnant women and when we help infants and young children build healthy habits early, we're shaping their outcomes for the rest of their lives. As someone who has a love for kids, the idea of preventing health problems before they even start is incredibly meaningful and impactful to me. ACNC looks at questions like, how does a mother's diet during pregnancy affect a baby's brain development? How does breastfeeding versus formula impact the gut microbiome? How does the way we introduce solid foods influence growth or allergies? These are big, important questions that influence real families. I also appreciate that the ACNC is right here in Arkansas. It supports our communities, including rural families that don't always have access to medical research or health programs. I love that their work doesn't just stay in the lab, it translates into real recommendations that help real people. Overall, I chose the ACNC because it's a program that aligns with my values, my interests, and the kind of impact I want to have in the future. The mission of Arkansas Children's Nutrition Center is to advance scientific research on maternal and child nutrition in a way that improves children's growth, their metabolism, and long-term well-being. They aren't just studying food, they're studying how nutrition affects almost every system in the body during early development. Their vision to enhance parental and child health through food, nutrition, and physical activity. What I love about this is that they're not just trying to understand the nutrition, they're trying to use that knowledge to create healthier, stronger families. Their core values come from the Arkansas Children's Hospital and include safety, teamwork, compassion, and excellence. You can really see these values reflected in how they work. Their research is extremely careful and family-centered. They work closely with mothers and children who participate in their studies, and they treat families as partners, not just data points. This combination of mission, vision, and values shows that the ACNC is not just a research facility, it's a place that genuinely cares about improving the lives of Arkansans. Their target audience for the ACNC is pretty broad, but it centers around pregnant women, infants, and young children. These are the groups where nutrition has the most dramatic and long-lasting impact. Many of their studies involve mother-children pairs. For example, they study how nutrition during pregnancy affects fetal development, or how different early feeding practices influence a baby's metabolism, brain development, immune system, or body composition. They also work with many families across Arkansas who volunteer to participate in their research. This includes families from rural areas who might not normally have access to major clinical studies. The fact that the AC&C includes these families means the research reflects the real diversity of our state. In addition to families, AC&C's findings are used by healthcare providers, nutritionists, and researchers who rely on evidence-based information to guide their recommendations and policies. So their audience is not just children, it's anyone connecting to improving child health. What community does the AC&C fill? AC&C fills a really important community need by addressing maternal and child nutrition, something that is especially significant in a state like Arkansas. We see higher rates of childhood obesity and metabolic disorders. Many of these health issues begin in very early life, sometimes even before birth. The center studies key early life factors such as breastfeeding, formula feeding, the introduction of solid foods, and physical activity. They look at how these early experiences shape a child's growth, metabolism, and long-term risk for diseases like diabetes or even obesity. This research doesn't just stay in scientific journals. It gets to shape pediatric nutrition guidelines and public health recommendations. Another major need they fill in improving access to health resources across the state. Families from all over Arkansas, especially rural or undeserved areas, can participate in AC&C studies. This gives them access to nutrition assessments, health screening, and professional support they might not otherwise receive. By bringing together scientific research and real-world community engagement, AC&C helps ensure that Arkansas families benefit directly from evidence-based nutrition guidance. They are truly bridging the gap between research and community health. Activities to promote nutrition and health. The AC&C carries out a wide range of activities, and their work is incredibly comprehensive. Their main focus is research, especially research that explores how nutrition and physical activity influences a child's development at the biological level. They study metabolism, brain development, immune function, and even the gut microbiome. These are areas of research that help us understand why early nutrition matters so much and what we can do to improve these outcomes. AC&C conducts clinical studies involving pregnant women, infants, and young children. Some examples include research on the effects of breastfeeding, the role of diet and food, allergies, and programs that involve mother-child physical activity and healthy eating habits. They also emphasize community engagement, meaning they work directly with families to promote healthier lifestyles. This includes education, nutritional support, and opportunities to participate in health initiatives. Finally, they train scientists, healthcare workers, and public health professionals, helping them apply new research to their work. The training ensures what AC&C discovers influences future generations of professionals. Public policy plays a major role in the AC&C's operations because a large portion of their funding comes from the USDA Agricultural Research Service. This means that federal decisions about research funding directly impact what studies AC&C is available to conduct and how far their work can expand. At the same time, AC&C's research helps shape national guidelines and public policy. Their findings influence recommendations for infant feeding, pregnancy nutrition, childhood obesity prevention, and long-term health planning. So while policy affects them, they also have a strong impact on the policy. A few interesting details include the fact that AC&C has been operating for more than 30 years. It's also only one of 2 national human nutrition centers in the United States, focused specifically on mothers and children. They have advanced labs for brain imaging, metabolism research, and microbiome analysis. And what I personally love is that they work with families from all across Arkansas, which makes their research diverse, relevant, and community-centered. In conclusion, the Arkansas Children's Nutrition Center is an incredibly valuable program, not just for Arkansas, but for maternal and child health overall. Their focus on early nutrition has the power to influence long-term outcomes and prevent diseases before they even develop. As someone who loves kids and wants to make a difference in their lives, I really admire the work that ACNC is doing. They combine advanced scientific research with real community involvement, and their findings help families, healthcare workers, and policymakers make better choices. They're truly building healthier futures starting from the earliest of days.